So I was in line at a deli at Kaiser in Mid-Atlantic, so in the Baltimore area, and they had a employee deli, and I'm in line, and a girl taps me from behind and says, "You're Robb Munson." And I look at her and I'm like, I don't know who that person is. I'm like, I am. I was trying to look at her name badge, but I was turned around. I'm like, I'm sorry, I don't know who you are. And she's like, oh, this is how you'll know me. She opened up her purse. She pulls out a sheet of paper that's folded up and tattered, and she hands it to me, and I look at it, and it's my handwriting. I now begin to visualize what happened. Whenever an employee said that they wanted to talk about their career advancement, I would sit down with them and oftentimes would map out a timeline for them. And she said to me, I have spent the last 8 years following this timeline. I'm the first person in my family to ever get a college degree.
Welcome to Healthcare Ops Wave. It's not only an acronym for how, but also healthcare operations and waves are actually very similar. Both are steady, run in cycles, and have the odd storm in between. I'm Frederik Mueller. I'm the co-founder and CEO of Third Way Health, and we'll bring you the stories that shed an inside look on the humans behind healthcare operations.
All right, welcome to another episode of the Healthcare Ops Wave. I am incredibly excited to introduce our next guest. Robb, thank you very much for taking the time and for being here.
Thank you. I appreciate you giving me this opportunity.
Yes, and honestly, I don't think I could introduce you nearly as well as you can probably yourself. So maybe let's go ahead and dive right in.
Yeah.
Can you give our audience a little bit about your background, what you've been up to, and also how did you get started being in healthcare?
Yeah, that's great. So I've been I call myself a healthcare operations executive for about the last 30 years. I spent 22 years of those 30 years at Kaiser Permanente having the opportunity to build all of their shared services capabilities. So from call centers to premium billing and enrollment to claims to member grievances, I had the opportunity to build those initially at a pretty large scale within California. Kaiser has 8 regions across the U.S., but the primary region is two regions in Northern and Southern California. So I got my start in Southern California and then moved across the country. I then spent 4 years at a startup, so a pretty small plan. I think I was employee number 10, Canopy Healthcare. So went from large Kaiser to this small Canopy Health. And it was great in a startup, where you have no members, you build your network, you build all your outsourcing capabilities and the like, and then start a plan, work with the regulators and such. And so I had a great time for 4 years doing that. Right at that time is the time COVID hit and impacted all of us. So I was now at home the majority of the time and started getting heavily recruited by a company called Centene. So those that might not be that familiar with Centene, it's the largest health plan no one's ever heard of. They own about 30 health plans across the United States, including in California, they own Health Net. And so they recruited me to become their regional vice president of member and provider services. And so in that role, I managed both in-house, W-2 employees, and then we had a number of vendors, both domestically and all across the world. And so at peak during open enrollment, we had about 20,000 customer service reps answering phone calls. Was there for 3 years. Great job, great organization. A very, very busy job. It was one that you're going to, lean in and give that 110% or more. And then ended up wanting to come back to California. So my wife and I moved from Southern California, where I grew up and have lived my whole life. For Centene, we ended up going to St. Louis for 3 years. And as we transitioned back to Southern California, I became the senior vice president of operations for Astrana Health. And so had a spent about half a year there. Wasn't the right fit for them or for me, and that's all right. And so over the last couple months, I've published a book, done some consulting on the side, and potentially am looking at a new opportunity that will might unfold here in the next couple of weeks. So that's a little bit about me.
That's exciting, and I think we obviously we've crossed paths in when you were at Astrana, but I think what really I thought will be fascinating for us to unpack is just your observations from going and scaling an organization at Kaiser to going the startup level to managing 20,000 agents, right?
Yeah.
There's a lot to be learned, I think, from you on how to manage these large groups of people and also what this means organizationally. And so I'm very blessed that
Yeah.
we get to have you here. And also, maybe you can there'll be some opportunities to share some stories about your book. By the way, for
Okay.
everyone in the audience, it's called Moving Forward, Amazon bestseller as a book or audiobook. It sounds like a fantastic read for everyone to check out. So, take us back to the beginning. How did you end up in healthcare? I don't know how many people start their career and say they're going to work in member and provider services or claims. So, how did you end up there?
Yeah, and it's kind of a funny story. It's it's one of those. The book talks a little bit about various failures, and all of us have had business or personal failures in our lives, and our focus then is to kind of pick ourselves up off the ground, dust ourselves off, and move forward. Hence the name of the book. And I got into healthcare through a failed interview, and so I was working for Compaq Computer Corporation. They were taking their technical laptops and bringing them basically to people's houses, and so their entire business model changed for the good, for the consumer. Well, that left me out of a job. I was the administrative regional administration officer at Compaq in Southern California, and so I began looking for a job, and I actually applied for a financial officer job. And when I got into the interview, the vice president interviewing me said, "You're not the right person for this job." And that was her foray into the interview. It was like, "You're not the right guy." And I'm like, okay, are we going to have an interview? And she's like, I don't see why we should. And I said, well, I just drove an hour to get here. And so she nonetheless said the interview was over. So I dejectedly went back to my car and drove home and said, wow, that was crazy. Ended up taking a different job in the computer field, and got a call, I don't know, 9 weeks later from this same lady. And she said, I have the right job for you. It's in member services. I think you would be fantastic in this job. I'd like to hire you. And so I remember kind of joking with her. I said, well, I'd like to interview with you first. And so the next day we interviewed, and from there she offered me the job. So I ended up getting into customer service in healthcare that way. And I was at that organization about a year and a half before Kaiser then came and recruited me to build their call center infrastructure.
That's a great story, and I'm sure there's many more where that came from. I think a big question that I always find fascinating is what have you seen about how organizational operating models need to evolve as organizational size changes, right? And I think again you've sort of been through all sizes and changes, and also talk us about are there certain inflection points that you see when organizations should be thinking about doing things differently and changing their operating model to accommodate that?
Yeah. I mean, I think that, early on, again, 30 years ago, I think healthcare was more focused on bricks and mortar, W-2 or, their own employees. Didn't do a whole lot of looking outside to see is there expertise that we can leverage to help us handle that. Now, what I've seen over time is that's morphed in a good, positive, healthy way. I know that when I started at Kaiser, unionized environment, and basically was working with 4 different unions and having to hire all my employees as W-2 employees full time. Very hard to, when you think about it from a cost standpoint. Well, anyone listening to this knows that in a call center you have peaks and valleys. So you have times where the call volume, it's so high, it's so difficult to manage, and your service levels getting crushed. And there are other times in those valleys where your service level's sitting at 100%. You have 70 agents sitting there waiting for a call. It's very inefficient. And so you run into times and situations, I know I did, where I would be understaffed in certain times, I'd be overstaffed at other times, and really couldn't create that good balance from a service and cost standpoint. And so we begin to look at other options as well. When the Affordable Care Act came into play, that was a time where I had explained to my senior leadership, like, either I need to build another call center, or we need to start looking at some outsourcing opportunities. And so we did both, but I initially went for a few years to a couple different partners to help us with calls and to make sure our service level was good and strong. And then we eventually did build another call center. But if you think about looking at efficiency in a way that most of us in operations, have to look at efficiency, because our budgets oftentimes are shrinking, and yet the service level, or quality levels, or whatever it might be, productivity levels, they're not changing, and oftentimes they're even getting ratcheted up. So I think that one of the things that I learned was I had to figure out how to leverage a flexible workforce, and we did. Whether it was at Kaiser, especially we did at Centene. Now they were quite more advanced, I think, in a lot of ways, just from a labor standpoint. And then it becomes the trick, if you will, of how do you really manage your external workforces. I did it just in part through spending time at each of the locations. And so if I had to go across the United States and spend some time with some of my vendor partners, domestically, I would. If I had to go, into another country, into the Philippines or wherever it might be, I did. And I think then my partners realized, wow, this is really important. Clearly, we measured all the metrics from A to Z, and that was key and essential. And then what I tried to do with each of them, and this is a little bit getting into this moving forward piece, Frederik, where I would then push my newsletter, my articles out to all of, whether you were a W-2 employee or you were a partner employee, everyone was reading my newsletters and oftentimes responding back directly to me. And again, part of that was just to encourage them to become the best version of themselves possible, and to use their present job as the vehicle to their dreams. And so, gosh, who's your best, call center supervisor? Oftentimes it's someone that has taken calls. Now they need some managerial experience, but they understand what the job is like. And so we would see, whether it was at Kaiser, Centene, or elsewhere, that folks from the lower levels would continue to just move up the ranks over time. And I actually have seen a couple of my customer service reps move from customer service rep to vice president at Kaiser. So can be done. It's a lot of levels that they moved up over time, and they were the ones that did it. But sometimes we as leaders need to foster the development side of people and really spend a little time. So I did kind of balance the fact that we had KPIs to hit, and balance that with the people side of the business. And I think whether it's large or small, I think being able to have a clear articulation of what good looks like and where we're going, from a vision standpoint, and then being able to translate that down to the frontline staff, and to help reinforce that with them. Again, for me, it was through these articles that I ended up putting into this book. And for other people, maybe other mechanisms as well.
I think you touched on a lot of really important points, and I want to make sure maybe we can dive deep on some of them. So, as you're talking about developing leaders, and we even talked about, before the show around how do you communicate to 20,000 people? Take me from your perspective as COO of employee number 10
Yeah.
to, being at Centene or Kaiser, thousands of people in different places. How should other leaders think about um, communicating vision, KPIs, communication, right? Just general organizational structures as
Mhm.
maybe other organizations are going from, having 10 employees to having 10,000.
Yeah. Yeah. And I think so. We'll start with Canopy. 10 employee number 10. Very simple to do when you think about, you're walking around the office, that notion of management by walking around. I mean, I was able to literally talk to every employee every single day, right? So we were all in the office and I could talk to them, no problem. I mean, there would be times that I would do these half day, retreats. So I could easily close an office, have everybody show up at a, hotel and do a half day, team building event, talking about the vision so that people were really clear on the vision, being able to give all of the financials and the metrics and the like, and then do some people and team development at the same time. So that was really, I would say, pretty easy to do in that sense. Then when you get to these larger organizations, they're much more complex. I still did my team building pieces. And I think at Kaiser, I had about 120 people that would come to my team building, what were within, I just called it my management organization. So I'd pull them in from across the country. We'd have a couple day retreat. We would reinforce the goals for the year. We would talk about where we were from a metric standpoint or finance standpoint. We would acknowledge different folks for doing a variety of cool things from an individual standpoint. And then we do whatever team building. A lot of times our team building would be some type of community service that we could do. I mean, I actually took this team once down to Mexico, and we actually built 3 homes in a day, which is pretty cool. And
Wow, it's incredible.
a lot of people at Kaiser will still remember me for that. They'll be like, "Yeah, you took us to Mexico." So if you think about the size of Canopy and the ability to literally talk to each person each day versus a complex Kaiser, multi-locations, communication is essential, clearly. And being able to convey and measure, convey the vision and then measure the progress on a very routine, within a call center, there's so much data there you can, measure it every hour if, someone really wanted to. But you could look at your daily and weekly, performance reports and understand, did we achieve success that week or not? I think in a larger organization as well, I think the complexity that comes in is with other departments as well. And
Yeah.
so I think the leader needs to spend his or her time with other leaders and being able to talk about what's working, what's not working, what we can work on together. And it was kind of interesting in the sense that Frederik talked about the moving forward book, and that's what it looks like in case you wondered. But that's just a compilation of these stories over time. And a lot of leaders from other departments would want their employees on that list as well, on that email list. I would push it out through email. But I think getting connected in with, other leaders in the organization is absolutely essential. And so you've got this leadership team that has your vision, that is executing on the vision, that you're able to connect and reach down to the frontline employee. And again, for me, it was through a newsletter that I wrote. It wasn't some ghostwriter. It wasn't some, 27 things. It was focused on here's what I'm going to focus on this time. And took about 3 to 5 minutes at the most to read. So it wasn't a big commitment. And there was always a challenge in there. And so that frontline employee would get reached, kind of get touched in that sense. And then across, I would meet with the variety of directors and VPs and regional VPs and senior VPs and whoever else to really make sure that as we were making sure that the member experience or provider experience was solid, that all of us were really focused in the same direction. So that's how I've managed it in both small organizations and then more broadly across these large organizations.
So it sounds like, what you're, even at a very large scale, it's all about alignment still for you, right? Like you got to
Mm-hmm.
align your leaders to talk on your behalf, and then you found great success in writing a newsletter to everyone that or writing an email update that now is informing your book, so that everyone that couldn't hear directly from you still would know who you are and what you are thinking about.
Yeah.
How did that work? Can you give us some feedback? Like, how was that received? What did that look like? How often did you send it out? I think that's such a fascinating best practice.
Yeah. So, I'll give you so I would, uh, my admin, we would come up with, you should say, here's the date we're going to publish. So then I, as the writer, would figure out, most of my articles, in all honesty, were written on Southwest Airlines. So I'd be going from one location to another location, and I would end up on the plane, and I would just get my iPad out, and I just start typing away. There wasn't any rhyme or reason to what the article might be. And again, for a little more background on me, so my undergraduate degree is in psychology, and then I also have an MBA. And what I always felt with that is if I could understand people and then understand business, those would make for an effective leader. And so I do use some of my kind of psychology background as I write an article. And I'll give you, an example of one might be me writing about when I was divorced about 2 decades ago when I got divorced. Well, probably about half of the marriages, I believe, maybe off by 10% here or there, half of the marriages in the United States end in divorce. So if I'm writing an article about my divorce situation, again, very personal, and you can look at that in that sense as a failure. Like, wow, I felt, well, guess what? 1 out of 2 people reading the article have also been through that. So it's not like it's something that no one would ever have gone through. Like, oh, wow, that's terrible, but doesn't really relate to me. Well, I would write articles that relate to pretty much most of the readers. Maybe I was terminated from a job and I write about that. Or I interviewed for a job and I didn't get the job. Or, again, a divorce or a breakup in a relationship, or a problem with a kid or an aging parent. So a variety of topics that people could relate to. And then I would write it from really my personal experience with it, and how I felt about it. And then I would turn the article back to the reader to say, when's the time in your life you've felt this way or had a similar experience, right? Get them to kind of pause and reflect. And then I would kind of end the article with a couple of paragraphs about, healthy ways to work through stuff. And maybe it's getting out for a walk and talking to a close friend about how you're feeling about this, that, or the other, or working through it more professionally, whatever it might be. And what I found with that, and let's say I push that out to 5,000 employees, I'm now getting, well north of 100 responses back of people now writing directly, emailing directly with me to say, wow, that really touched home. This is what I'm going to do. this is how it's impacted me, or sometimes they would tell me their own personal stories. That would make my story pale in comparison. But it was a way to connect. And again, with the focus of them becoming the best version of themselves possible. And again, if you have an employee at the front line who feels hopeless, that they're in a job, they're in an hourly job, they don't know that they're necessarily going to ever advance in their career. And now they see someone at the executive level writing and telling them a very personal story about, about my life. Yeah, a lot of people are going to connect with that. And again, it was a variety of topics. And in the book, it's 75 stories. And then I have what I call front matter with a variety of kind of psychological things to help people, kind of connect in more fully
Yeah.
and be able to activate some of those stories as well.
You wrote this what, like weekly, bi-weekly?
My goal was always to write one a month.
One a month.
Yeah, that
And
was,
then always a personal
yeah,
story
yeah.
that had
And
a
so,
lesson sort of to like inspire and ground and sort of show, your personal side to the team. That's
yeah, and
great.
let me just quickly, I'll tell the group a quick one. So I was in line at a deli at Kaiser in Mid-Atlantic, so in the Baltimore area, and they had an employee deli, and I'm in line, and a girl taps me from behind and says, "You're Robb Munson," and I look at her, and I'm like, I don't know who that person is. I'm like, I am. And I was trying to look at her name badge, but I, was turned around. I'm like, I'm sorry, I don't know who you are. And she's like, oh, this is how you'll know me. She opened up her purse. She pulls out a sheet of paper that's folded up and tattered, and she hands it to me. And I look at it, and it's my handwriting. And it was I now begin to visualize what happened. It was, whenever an employee said that they wanted to talk about kind of how their career advancement, I would sit down with them and oftentimes would map out a timeline for them. And she said to me, I have spent, the last, 8 years following this timeline. I'm the first person in my family to ever get a college degree. And now I'm, a manager here in Baltimore. And this was a frontline employee in Corona, California, who I talked to, and I said, I'm so sorry, I just don't remember you because I've had hundreds of these interactions. But this lady had her tattered piece of paper in her purse, and she kept it with her. And it was just remarkable that I'm across the country and talking to this lady. But clearly, I hadn't talked to in nearly a decade.
Wow.
And she still had that with her. So it's articles like that any frontline employee or really anybody can look at it and go, well, she did it, I can do it. It wasn't like some heroic thing. She just continued to press on, move forward, and she achieved her goals. So
Wow.
those types
That's
of stories.
incredible.
Yeah.
Robb, I really appreciate you taking the time and sharing some of your stories and wisdom, and we'll make sure we'll display the book for everyone because I think it's a great read. And yeah, I think it was, especially in the age of AI, I feel like it's very grounding to hear you talk about people because I feel that it doesn't get the time and attention that it rightfully deserves, right? But it is what makes up healthcare. So we'll talk to you soon. Thank you.